Time now for our weekly free therapy.
Yes, and this time it's for our kids because summer's really a good time. We're kind of spending more time with them. We're seeing things. Good time to check in on their mental health and see what we can do. Joining us now is Dr. Laura Saunders. She's a child psychologist with the Institute of Living. Hi, Doc.
Hello, friends, and happy Wednesday.
Happy Wednesday to you. All right, before you even get into it, I think the most disturbing thing about the information that you sent over is that at least 1 in 5 adolescents has a diagnosable mental illness, but only 1/3 of those will have received treatment. That's disturbing.
That is disturbing. And it's also important to know that 50% of all lifetime cases of mental illness start by the age of 14. 14, right? So this is really important. Early intervention is really important because it changes the pathways in the brain, the neural pathways. It also changes habits. So what happens if someone is severely depressed or very anxious or they've had trauma? It creates a set of behaviors, it's a set of cognitions, and it creates, changes in how you view and see the world. And then how you view and see the world then affects how people interact with you. So it's very, very cyclical. So the earlier we get intervention, and that is therapy and possibly medication, the better it is for our young people.
Okay, so what do we do about that? Because some people don't have access to it, or even maybe their kids are saying, I don't want to go. Or, I mean, what do we do if we're thinking, gosh, I'm not sure if this is okay, the behavior I'm seeing?
What I like to do is really appeal to, first of all, appeal to your teen and say, listen, without the structure of school, that's when you can really see things deteriorate. So in school, like they get themselves to school, they get themselves to their activity, they kind of barely get through. But now that the structure's away, you can really see a deterioration in functioning. And what I like to say to young people is, are you happy? Are you okay with how your life is? Because I don't think you are. I think you're miserable. I mean, what we see is that, yes, all teens are kind of moody, but when moodiness and irritability is so pervasive through everything they do that they're not able to function, that I like to appeal to, look, you don't look happy. You can't feel good. Let's try something to make you feel a little bit better.
Can we talk about the stigma? Kids don't want other kids to find out that they might need therapy and might be getting help. I mean, how do we address that?
So stigma's definitely a factor. And in the beginning, what I, certainly emphasize is that this can be really private. But I think more and more as kids open up, they realize that other people they know have been in therapy. Yeah. And I'm going to tell you a little secret. This is the best time to get into like either a mental health clinic or see someone in their private practice because their regular clients are taking vacations, so they have openings. So this is the best time to get in with a new provider.
That's a good idea.
Okay, right, because a lot of times waiting lists, we don't have as much access. And so step one, if you're a mom listening right now, how would you know if it's time to take that next step? Where do you start with the pediatrician, or you just say, you know what, I think we need to go sit down with a psychologist and see what they might have to say?
Step one is identifying that the behavior that you're seeing or the presentation that you're seeing and observing is not typical of your child and that it's hindering their functioning. So that's step one, identifying it. Step two is, all children have a pediatrician. Step two could be checking in with your pediatrician and having them evaluate. It's always good to rule out a medical issue. All pediatricians' offices have access to referrals. Some now even have integrated care where they have a clinician on staff.
I love that.
So you can check with your pediatrician. You can reach out to a local child and family services. All towns have child and family services divisions. You can, if you have connections, you can reach out to someone that you know for a referral. I get people asking me all the time with help for referral, so I help people all the time. But this is a good time because a lot of those practitioners have openings because their regular clients have taken time off in the summer.
And then the other thing is, like you mentioned, that they're going to find out. You just said the statistics: 1 in 5 have a mental health disorder, and that might not mean that kids will be, I'm not crazy. I don't need. That's not what it is. They might have anxiety. They might have depression. We all know as adults, we've all experienced a lot of this. So the idea would be telling them this isn't forever, but we're going to do a period of time, and you're going to feel better, like with a goal.
Absolutely. So it's really saying, like, look, you don't look happy. You seem miserable every day, all day, not getting out of bed. You don't do things that you was typically, used to be enjoyable to you. You're not eating right, or you're overeating, right? You're listing off specific things that you're observing. And you're saying, look, let's get some help and support. This is the best time to do it, because it's a little easier to get in and get access, and that you want to help improve the quality of their life.
All right.
I love that you're saying we're doing it for the kids, so it's not just us forcing. We're going to talk more about it on the Cares Cures podcast. You'll give us some scripts and how we can handle it as parents and learn more. So thank you so much.
Have a great day.
All right, you too. Dr. Laura Saunders from the Institute of Living. Always some great advice there.